In our country, Tanzania, there are so many heart patients, especially children.
Now, congenital heart disease is a very big issue in the African countries, and there are a lot many kids suffering from this problem there with not adequate treatment facilities, all the diagnostic facilities available in there.
Normally the heart surgery for kids is always challenging because they are a very small body surface area, and they are very much immunocompromised. Most of them they catch infection very fast. So these kids are very prone for infection, and their counts was also abnormal.
Now, these kids ranged in age group from 7 months to around 4 years, and many of these kids had problems such as hole in the heart, which were making them difficult to grow, and at a year of age they were 4 kgs or 5 kgs in weight, and some of these were extremely blue, requiring urgent treatment. Now, these kids underwent varying procedures, surgical procedures to close the hole in the heart, to open up the arteries which were blocked, and some of them underwent non-surgical procedure wherein we opened up the valves using balloons and closed the holes in the heart using devices.
Since 10 years ago, we've been coming to India for management. And so far we have treated for cardiac management, either surgical or medical. And so far we have treated 30,000 children. We have come here under the banner of Heart Baby Project.
When we were approached by the Lions International and their sister agency in Tanzania and Regency Hospital, they knew about this background. They knew about the kind of work that we have been doing over the past so many years in this country, and we've been treating patients from all across the world, and that encouraged them to actually associate with our program following their scout mission.
We will talk with the Lions Club and then find out the way to come here. Fortunately, the Lions Club agreed, so they started donating, because most of these patients are not able to come here. They can't pay any amount here in India when they come for surgical or medical treatment. So Lions Club has started donation.
What we are trying to do is we are trying to provide some kind of succor or probably some kind of relief to their existing problem by correcting the defect. But the treatment part continues even after surgery, because some of them do have certain degrees of heart failure when they go back after surgery. So an aftercare is an extremely important issue.
Best part is that once treated, these kids are going to have a normal lifespan with a relatively normal quality of life. That is the best part of treating these children. Not much of rehabilitation is required. Just a special care for 1.5 months would be required for these children, and most would be free of medications after a month of treatment.
In that way, we are very happy, very, very happy that we managed to send 43 patients this time, and we hope to send another 25 patients in February. When I come back, I will come back again here in Fortis Memorial Hospital to bring 25 patients, all with heart problem.
I think we are able to also empower by this interaction and by our association with the Lions Foundation. We will be able to actually help diagnose more children, be able to reach out to greater populations that will be able to source out and find out the hidden pockets of heart disease within their own community and get them out in the open, so that some form of care could be looked at, or some kind of curative therapy could be looked at.
My experience in this Fortis hospital actually is good hospital in this world. Clean hospital, good doctors, and many things. And the other things, when you come in this hospital, there is so many people inside. Maybe you don't know where you go. There is so many coordinator that can take you to the many place.
We are happy. Everything here is very good. People are very good, and everything goes quickly. Really.
It is a very fulfilling experience, especially when you're treating children with heart disease, because every single operation is different, every child is different. The same defect in two individuals is a different defect.
Children across, from whichever country they are, we get very much involved in the children. It's more of a personal one-to-one thing. Yeah, the language barrier comes in place in this, but in spite of language barrier, when the patient manages or the patient attendant manages to communicate what the problem for them is, and the best part is when a blue child comes to you and you bring a smile to the family, the moment the surgery is done, the child is pink, and the smile to the mother's face, and many a times it happens that the mother is not able to recognize her own child.